Really? COVID. Unfortunately, it is true. We have another COVID spike. So the question is, should we be worried? The news shows that there is a COVID surge and it's going across the US. Understand too that the numbers may not reflect it because in most countries of the world, we have stopped counting. However, we are seeing it because we're seeing it in our urgent care clinics, we're seeing it in the emergency room, we're seeing it in the doctor's offices, and we are seeing more and more COVID cases resurfacing. So therefore, it is good that we should know about it and be reminded about it. Amen? All right. So the new surge seems to be caused by what is called the FLiRT variant. Now understand, the FLiRT variant is not just one variant. It's a combination of a couple of variants that are around now. And honestly, we're not microbiologists. It's really not that important for us to know the nitty-gritty details about the FLiRT variant. What we need to understand is the principles that we need to subscribe to and the things that we need to do. Next slide. If you see that orange line, the orange line actually shows that this is what, 11% increase in positivity in terms of positive testing in the States right now. The blue graph, it shows that the death rate is still very low. If you realize all the way at the end of the graph, there's a little rise, noting that there is a small increase in COVID-related deaths, but it is not that great. And we understand why, because the virus nowadays is not as severe as what it used to be in Delta times. Next slide. So again, as I said, testing is not, we really have not been as vigilant with testing as we were during the actual pandemic itself. We need to know that. However, we also need to take guard, because if we do have the symptoms, we should get tested, and you should get tested. Why? Because you should have that knowledge to empower you to protect the people around you and to know what to do. So remember the symptoms, all right? The symptoms of COVID-19, we have fever or chills. A lot of people tend to have the fever or chills, cough. In fact, the cough is not even as prominent as it used to be. Sore throat, congestion or runny nose, headache, muscle pains, body pains. A lot of the patients I've seen, they have been having the headaches and body pains. You may have difficulty breathing, fatigue, a new loss of taste or smell. Some people even tend to have brain fog. So while they're suffering from the illness, it's like they're not thinking straight, they feel like their brain is in a fog. And a lot of people have reported gastrointestinal symptoms. So they may have tummy aches, they may have diarrheas. They may have related gastrointestinal symptoms. This is the situation here. While the COVID-19 illnesses are now milder, they're not as crazy as the previous, as the Delta virus age, as the height of the pandemic. However, there are still some subsets of people who are still at risk. So the people who are older, 65 years or older, in fact, some places say 60 years or older, all right? These people are at risk of more severe illness and also risk of death from COVID. People with chronic lung diseases or asthma are also at risk of more severe illness or death. People with heart failure and heart-related problems, people whose immune systems are suppressed either through diseases such as HIV and AIDS, or people who are on cancer treatments, people who are on immunotherapies, and those, they are at risk of more severe illness. People who have diabetes. Diabetes is a chronic state where your immune system is not working as good as it should. And people who are obese, which is a very wide proportion of our population, are at risk of getting more severe disease. So what do? We must still be vigilant, all right? This slide just summarizes a lot of the things that we should be doing, and I'm going to address them not necessarily in the same order. Remember, hygiene practices. If you're going to cough or sneeze, you do so in your elbows or in a tissue that you can dispose of, all right? Remember, even in church, remember we hug and we smile and we shake hands and everything of that sort. This is the same hand we're going to use to wipe our eyes and touch our face and all the rest of those things. Be vigilant in hand washing and be vigilant in the use of hand sanitizers, where you wipe your entire hand and you let it air dry so that you can kill the germs on this. All right, this is hygiene. Next, before, we still have some more we're going to be touching on that same slide, so let's stay there for a while. Where possible, get some time in the outside where the air is circulating and fresh as compared to the bottled up air that sits inside, all right? Again, a lot of the air-conditioned systems do circulate the air, pass through filters and everything of that sort to help clean things up, and that is true. The best that you can do is actually air that is circulating outside. So we have to strike that balance because you know the summer is hot, right? Remember, again, now I'll tell you about treatment. Right now, there's no real treatment for COVID-19. It's a virus and a viral illness that we have to work through, and our body has to fight it off, and we have to spend that period of time until we get better. So what are you going to do? You're going to do all the things in your power to make sure that your immune system is strong. So therefore, we're the ones who have to be resting and getting good rest. We should be drinking enough water and staying hydrated. We should be eating the right foods that are healthy for us, that will make us healthy and keep us healthy. All of these things are the things we're going to do to help us fight off this illness if we get it or even prevent it. Where does immunizations fall in? Again, people, and my people, it's a sensitive topic, and the reason that it's so sensitive is because of all the controversy that it caused when it came out. Experimental this, experimental that, mandate this, mandate that. Some of us really went all the way into pushing the end of times with regards to that crisis, but understanding, people, immunizations still serve as preventative medicine.